Hi, Gillian Brown here at Harpenden Sports and Spinal. You may have been diagnosed with a disc bulge or disc herniation on an MRI scan. So you can see here, this is the 3D version of the disc. This would be L45 and L5S1. And if we look at it segmentally, we can see the disc. Now, an actual bulge itself, what we can see is that the disc wall bulges or herniates or prolapses and hits the disc, hits the nerve tissue, and that can be extremely painful. So that's showing a left-sided bulge. What we can see also is it can bulge out on the right side, again hitting the nerve there, or even come through centrally where it can hit both of the nerves. Um, the types of symptoms that we would expect to see, these are called the dermatomes, and areas of the body which can cause pain, pins and needles, numbness, or even loss of power. Now, if you have been diagnosed, if we move down the spine to, let's say, an L45 disc bulge, you'll get pain in the lower back here, front of the thigh, and can go all the way down into the leg. If it's hitting the L5 nerve, slightly further down into the buttock area, and then it can be the sort of shin pain as well, right down into the outside of the foot, or even the S1 nerve, which is the last nerve of the spine. This tends to be more sort of hamstring area and back of the thigh and into the calf area. So these are the areas where you can feel the pain or symptoms. In terms of solution, the solution that we use to help with spinal issues is spinal decompression, which is a really effective tool. Ours is called the intervertebral disc decompression machine. As you can see, you're going to be strapped up and connected to the machine forward, front and back. And what this does, if I show you through, is it decompresses the spine. So starts to gap the spine through here. We can do this segmentally. So if you have an L45 or an L5S1, we can target that area specifically. And by creating space in the spine, this will now show you what happens into the tissue itself. So the red area is the area that's hitting the nerve. That's the disc where the problem is occurring. So by decompressing that spine, we're now allowing an exchange of fluids to happen. So that disc has an opportunity to heal. We're taking it off pressure so we can get fluids in and out, waste products out, and then that will then take pressure off the nerve. Okay, so as it's decompressing it, it's creating space in that area, allowing the best opportunity and the right environment for that disc to heal so we can get that off that offending nerve. So just go back to that spinal tissue there. What we can see is we're going to, if it's L45, we're going to push that disc this way, top and bottom, using the spinal decompression table. And then we can also, which you can see on the spinal nerve, we can take pressure off that. So we're pushing that back in order for the disc to heal. So it can be a really effective solution to decompress that spine and allow the disc to heal, which is done in a non-invasive, very, very safe way. Okay, hope you find that useful.